people will try to log on and they are not able to. But it's a developing story, so we will continue. At this point, Sam Hart is joining me, the Director General, Abia State Marketing and Quality Management Agency. Hello, Sam. Welcome to the program. Hi.
Hello, Nancy. Good day. Good to have you here.
Good to have you too. How is Abia?
Abia is very calm. Abia is very wonderful, and we are doing well. Thank you.
Okay. The last time we spoke, we talked about the production of masks and all of that. Speak to me about what has happened, because you know, Abia is really dear in my heart. I have to say that, because it has, yes, it has Aba, you know, which is an industrial cluster. Aba should, you know, everybody should know Aba everywhere in the world, just like, you know, they hear about China or some provinces in China. Take a look at even Wuhan, that this virus originated from. Wuhan has a population of 11 million people. Wuhan contributes 1.6% to China's GDP. So why can't Aba do the same? You know, so that's why I'm really interested. And since that day we've finished, I'm happy that as a result of that program, a lot of things have come out of it. So speak to me about the developments from the last time I spoke to you till now. What has happened?
Thank you very much, Nancy. I want to commend you for the platform you gave us, which has helped us with publicity for the work that we're doing. And to answer your question directly, from the last time we spoke till now, in a span of about 2 weeks or thereabout, a lot more has happened. We have gotten more orders. I confirm from them, I'm at liberty to say, the Victim Support Fund, which is headed by General T.Y. Danjuma and under the program run by Toyosi Akerele, they reached out to us, and we were able to deliver, you know, over 50,000 masks to the internally displaced persons in the northeast and around the country. And we've had reach out from corporate banks, HMOs, and other such organizations that wanted their masks personalized. We were able to deliver that to them. And Nancy, the report for April is in, because we have data analysts who are computing what we're doing. And I'm proud to announce to you that in the month of April alone, we have produced over 1 million face masks and distributed around Nigeria over 1 million face masks. This translates to over 200 million naira that has been channeled to tailors in Aba since Governor Okezie Ikpeazu brought out this challenge to the tailors in Aba to go in and fill this gap and do what they do best. So, and we've also created over 3,000 new jobs within this short period, because all the tailors now needed to employ new staff to be able to meet with the orders that were coming to them on the daily. Even as we speak, I've been taking calls since morning, and what we basically do is we aggregate. We take these orders and we distribute across the chain of tailors that are working with us to produce these masks. And we're very proud for how far we've come, what we've been able to do for them, and, you know, the foresight and vision of the governor to foresee this path that the whole thing would take, and for the opportunities that we have found even in the midst of the global pandemic. Nancy.
Okay. Is there any plan to scale up from what you're doing right now? Since you've produced 1 million masks, we are like 200 million people. Businesses would be gradually coming back from Monday. And like I said earlier, that as we go back even into the community, as we begin to interact more, we should take precautions, wear our face masks, continue to wash our hands and all of that. So are there plans to scale up from what you're doing right now? That's the A part of the question. The B part of the question is, for those masks that you are producing, are they certain kind of materials, or is it just like the normal Ankara materials that we're seeing right now? Because I realize that the other surgical mask, I think, they said is more protective than the Ankara mask. So are you also getting such kind of materials to produce? The C part of the question, I'm rushing it so that we can... don't worry, you can handle it. The C part of the question is are there plans to produce like PPEs for our health workers? Are you doing that already? Yes.
Yeah, thank you, Nancy. A part, expansion plans, yes. As we speak, it was because of even COVID. The governor had already set in motion the process for the establishment of a large garment factory in Abia, which will contain all the equipment that these guys require to be able to scale up what they do. But already, I did mention the last time, and I wish to reemphasize that there are over 100,000 tailors in Abia, and they are all on standby. We are working with about 2,000 so far, and whatever quantity that is required, we are able to scale it up by including new tailors to the loop. We are not working with everybody at the moment because which dovetails to the B part of the question about what we are doing with materials and standardization and all of that. We have been visited by the Standards Organization of Nigeria, and they have looked at what we do, and they have given us their guidelines, and they have certified our processes and, gave their directives on what we should do. We are using ultraviolet light to sterilize our product. And yes, our masks are mostly surgical. And then we also have the Ankara part of it, which is what, some people would require for, the fashionable aspect and all of that. And then we are also able to do customized masks and all of that for corporates who have required that we customize their processes for them. We've been able to do that, and we're quite grateful for all the opportunity that has come. So I've done A, B. What was the C part again, Nancy?
The C part is the PPE.
Yes, we are producing PPEs. I hope my eyes are not too blurry. I've not slept in 3 nights because I'm working with them at the tailoring clusters to make sure that this is done. Just this morning, we were able to roll out. We do PPEs. We do complete coveralls, which are made with waterproof material and zipped in front with the hood, and hands are tied. The leg has a covering and all of that complete. We do that. We supply to health centers in Abia State and even beyond.
Okay.
And just this morning, we concluded another one, which we were given specification for. It is an apron, the one that is worn frontally and tied at the back. And we're also able to deliver 2,000 pieces of that to an agency that requested for it for distribution to hospitals in their state. And we're covering about 27 states so far, by the way. So yeah, we're meeting demands nationwide.
So you guys are making money this period, the crisis, yes. And you're creating jobs.
We're not complaining.
No, Sam, say yes. It's not a matter of not complaining. Why I'm saying that is that I know that there are opportunities even in a crisis.
Yes. It is. That was the.
Since you've not slept, you're making money. That's good.
Abba tailors are making money, and that is it. This is the teach us how to fish philosophy, and this is what the governor has always said. It's not about. We're not saying don't give palliatives. We're not saying don't, but just give them the means to be able to fend for themselves and make their own money and all of that. And this is how we are contributing to the GDP of both Abia State as it is, and even Nigeria as a whole. And Nancy, there is a whole lot more we can do. Again, on your show, if you give me the permission, I'm calling on the Presidential Task Force, the federal government. I heard the CBN Deputy Governor talking, Bank of Industry, Smedan, Smedan, and all of them.
I was coming to that to ask perhaps this 50 billion naira intervention fund for MSMEs and households. So I think we should begin to look also in that direction.
Yeah, Nancy,
for some businesses there to take advantage of it.
Yeah, they should come and support us. Most of what we're doing, the governor was able to set up an MSME microfinance bank in Abia State, which is funding a lot of these small businesses. And I did tell you the last time we spoke that he also provided grants to the tailors that we're working with to enable them, because this was not their normal line of work, to enable them veer into this and start. And today they are all reaping the reward of it, even if it wasn't what they were doing before. So it is not what the state alone should be doing. If the federal government has all of these agencies and all of these funds that they have set aside to support MSMEs and all of that, I do believe with every modesty that Abba should be in the forefront of that conversation, and they should be calling us to ask how can we help you guys to scale, because see what we are doing already, even without much support, and then with the total support of the state government. And we're asking, at the federal level, let us have some of those support. Let them come, let them come and talk to us and be able to help our tailors to scale. It's not handouts, it's not aid, but it is support to be able to scale up the business, which is obviously supporting the economy. We have the capacity, I said the last time, to replace foreign, production of most of these things. Abia has the capacity to.
Wow, it seems we lost that connection. Let's try as much as possible to reconnect because we have 3 minutes to go, and I really wanted to ask some other questions before we end the program. Let's try and reconnect, guys. But you've heard it. I think the crux of today's show, it's around homegrown solutions to mitigate the effect of COVID-19 watch. We need to look inward, guys. We shouldn't wait for the Americas, for the Asian tigers to come up with solutions. We have African lions too, the same way they have Asian tigers. Sam, welcome back. We lost the connection. Final question before I let you go. You said you've started producing PPEs. How much do those PPEs cost? Because the ones that I think are imported cost about some 5,000 and above. So I want to know how much yours comes at.
Our PPEs in Abia, depends on the specification, is between 2,000 and 4,000. We deal in bulk orders, and that is what it costs, depending on what is required to be done. If it has trouser, if you want it with sleeves, if you want it with shoe covers, all of that. So the specification determines the price, but bottom line, baseline is about 2,000 a piece, and then it goes up to like 4,000, all depending on what they want to put in it.
So that's a lot cheaper, because I've seen the PPEs, but you need to see how these guys put on these PPEs. It's a full regalia, for their head caps to the stuff they use in covering their face that has like a glass, with the mask, with even the gloves. Are you guys thinking about that? The gloves, even hand sanitizers and all of that, because it's a lot of money. Can you hear me, Sam?
Mm-hmm.
Yes.
Yeah, Nancy. Yes, I can hear you. Yeah, we are producing the sanitizers. We are producing most of these things that you've talked about now. We've done the face shield. Okay. We've done the PPEs that we can produce anything, Nancy. Okay. That is the honest truth. We can produce anything.
Okay, but you can't produce a human being.
We produce a human being, but we can't give breath. That's the only one that we can.
Okay, Sam. I know we can get into that conversation, a 3D human being. But let's go ahead. Thank you very much, Sam, for joining me on today's show. I've been speaking with Sam Hart, the Director General of Abia State Marketing and Quality Management Agency. We've been looking at homegrown solutions